Afternoon, and thank you so much to the Miss Chair moderator for the kind introduction. First of all, allow me to congratulate the Malaysian Healthy Aging Association for convening this successful 10 Malaysian Hybrid Conference on Healthy Aging. I also would like to thank the chairperson and the scientific committee for inviting me to join you in these important sessions. So my topic is healthy behavior for healthy aging. Now today, for the first time in history, most people can expect to live into their late 60s and beyond. A longer life represents an important opportunity not only for older people and their families, but also for society as a whole. Additional years provide the chance to pursue new activities such as further education, or a long-neglected passion, while continuing to make valuable contribution for family and community. Yet, the extent of these opportunities depend heavily on one factor, health. So for this presentation, I would like to go over three things. First of all, what is really healthy aging? And the literature on healthy behavior and some of the tips that we could take home when we talk about healthy behavior. I think most of us by this stage will know roughly what is healthy aging. Now, as we know, the World Health Organizations have actually defined healthy aging for us. And the most important thing I would like to highlight is that healthy aging is talking about developing and maintaining functional ability so that people can be and do what they value most. And that is not only talking about meeting their basic needs, but also how to learn to grow and how to build and maintain relationship and to contribute to society. So the World Health Organizations have actually published a paper on global strategies on aging and health 2016 to 2020, whereby a 5-year strategy for action to maximize functional ability for all is being shared in this document, Decade of Healthy Aging from 2020 to 2030. And in that document, they have highlighted 5 important strategies, which is talking about commitment to action on healthy aging. In addition, looking at age-friendly environment, health system that will meet the needs of the older population, the system for a long-term care, and also looking at better measurement, monitoring, and research. And in that document, it also highlighted 10 priorities. And I would like actually to talk really in terms of healthy aging in relation to healthy behavior. And these are actually establishing a platform to change our behavior so that we can contribute towards a decade of healthy aging. Now, the other slides also highlighted other priorities which was being highlighted towards achieving healthy aging. So what is healthy behavior? Now, health promotion glossaries have already highlighted is that any activity that you and I take, regardless of actual or perceived health status, and the purpose is to promote, protect, and maintain health. Now, whether or not such behavior is objectively effective towards that aim is actually very personal, objectively orientated. So in the 1990s, there's also been a published definition that they highlighted is any activity or any behavior or habits that will help us to maintain our health, to restore our health, and to improve our health. So the earlier studies in 1970s highlighted that some of the features of lifestyle which will associate with lower morbidity and higher long-term survival actually included like not smoking, moderate alcohol intake, good sleep of about 7 to 8 hours, exercising, and eating well. So what does the literature say subsequently? Now, there's a lot of papers that actually came out to show that people who engage in multiple unhealthy behavior have a higher risk of death, chronic disease, and also poor cognitive function compared to those who do not engage in many unhealthy behaviors. And this actually is a study that was followed up for 16 years, a prospective cohort group of 5,100 men and women looking at the successful aging 16 years later. And they found that if you look at using healthy behavior as never smoking, moderate alcohol, having physical activity, and having good fruits and vegetables, a daily intake, that will actually be measured against successful aging from the terms of the cognitive, physical, respiratory, and cardiovascular functioning, and of course, the absence of any disability, mental health, or chronic disease. So they use this as their outcome basis 16 years later to find out what is the result. And they reported that participants are engaged in all the 4 healthy behaviors that I mentioned before had actually 3.3 times greater odds of successful aging. Well, these multiple healthy behaviors actually seems to increase the chance of reaching old age disease-free and fully functional in an additive manner. So these studies actually demonstrated that healthy behavior does affect successful aging. So what's the tips for healthy aging in terms of what should we do? Now, there's a lot of articles about, not only talking about having active life, doing exercise, eating healthy foods. There's also other multifactorial factors that actually can contribute to healthy aging. So in this 10 minutes presentation, I want to highlight to you 2 most basic needs that actually will help us to maintain healthy aging in terms of healthy behavior. So one of those is physical activity. Now, there has been study that says that if you actually engage in physical activity, it can increase your longevity. And the most group that's benefit in this is actually those that's older than 60 years old. Now, not only that it's actually, contribute to healthy aging, it actually improves your physical and mental capabilities and improves social outcomes in terms of maintaining your social networks, in terms of increasing community involvement, and also preventing diseases and reducing the risk. So what about healthy food? As you know, in Malaysia, one of the most important things and one of the most common topic is about food. But are we eating healthy food? So it has been shown by a study from the rural Malaysia that have identified that we have problem with overnutrition and undernutrition, as well as there's a lot of low levels of thiamine, riboflavin, and calcium, which contribute to good healthy aging. And it has also been reported there's a higher level of malnutrition, up to 60%, in many countries, not only in Malaysia, in older patients who are hospitalized or in nursing home. Now, if that malnutrition, obviously it will affect their health. So what is healthy behavior? Now, what we have talked about is so many factors, but definitely it's a very personal and it's a choice that we ourselves have to be responsible. And a healthy lifestyle is a lifelong process, actually. It's not only at one time of your life that you actually do a healthy behavior that will contribute to your healthy aging. So there's a need to make a change. And we have to ask ourselves, are we prepared for the change? And we must always remember to change our habits is not a quick fix. It is a long process. It does take time and we need a plan. But we also have to remember that it's okay sometimes that we did not follow the plan because we are human. But the most basic thing is that we must actually think of it in, small defined steps. We work ourselves towards our goal. So we visualize what we want to be. We model our behavior by looking at how people do it. And we should control our behavior. A lot of self-discipline will contribute to healthy behavior. And there's a need for positive reinforcement. Telling each other how well each of us are doing will actually help us to maintain our healthy behavior. So I would like to share with you, to conclude this presentation, I would like to share with you a video, a very short video, about 5 minutes, about healthy aging.
There is no way to avoid aging. But science has found some points that increase the probability of aging in a healthy way. Do not smoke. Tobacco not only damages the lungs, but also the cells in our entire body. On average, smokers die 9 years earlier than non-smokers. Drink little or no alcohol. The consumption of alcohol damages our body and our cells. Eat less. A reduced intake of calories can extend life significantly. It is important to keep a healthy balance because malnutrition can cause damage too. Exercise regularly. The old saying, if you rest, you rust, is true. Regular exercise helps your body stay healthy. Enjoy the sun, but with sunscreen. Sunlight boosts the production of vitamin D and happiness hormones. But UV radiation also damages the DNA. That's why you should only sunbathe with UV protection and not for too long. Learn to deal with stress in a competent way. Don't let others drive you crazy. Build a stable relationship. People in a long and stable relationship live longer. Educate yourself. Learning helps. A person who learns long and in a good way can age healthier. Don't forget medical checkups. Better be safe than sorry. Skin cancer, for example, can be treated very well if it is discovered early. Take advantage of checkup appointments with your physician. Enjoy life. Despite everything, do not forget to enjoy life. Aging in a healthy way is a mixture of genetic factors, social environment, and lifestyle.
So at the end of it, it's not the years in your life that counts, but it's the life in your years. And this is actually quoted by Abraham Lincoln. So thank you very much for your attention, and I pass back to the moderator. Thank you.